Hi, good evening, everyone, and welcome to the Epilepsy Foundation of Connecticut webinar series. This is Naka Anzalone. I'll be moderating the webinar for today. For the purposes of sound quality, so everyone knows, you will be put in listen-only mode, but we do welcome you to use the chat icon that you will find at the bottom of your screen. You can type your questions there, and then at the end of the presentation today, those questions will be answered. Our topic of discussion for today is sudden unexplained death in epilepsy, or SUDEP. Although a difficult subject for individuals and loved ones who are managing a diagnosis of epilepsy, it is our intention that this will be both informative and also empowering while promoting best practices for reducing risks and also self-management. We have two experts with us today who will be presenting. Dr. Lawrence Hirsch is the co-director of the Yale Comprehensive Epilepsy Center. He's also the professor of neurology and also the chief division of epilepsy and EEG and the co-director of the critical care EEG monitoring program. Some of his many interests and publications include brain stimulation for epilepsy, status epilepticus, and also SUDEP. Dr. Hirsch will be taking us through some general information about SUDEP, including the mechanisms for SUDEP and strategies also to reduce the risk of SUDEP. We are also joined today by Sally Schaeffer. She is the Senior Director of the Epilepsy Foundation SUDEP Institute. Sally holds a degree in healthcare administration and has spent most of her career in the healthcare industry. Beyond the professional realm, Sally's advocacy for the advancements of epilepsy treatments has extended nationwide. Her special needs daughter, Lydia, was diagnosed with electrical status epilepticus in sleep in June of 2013, and she at that time became a fierce and relentless leader in a statewide push for a law to provide alternative treatment options for individuals with epilepsy. And what was called Lydia's Law was enacted in Wisconsin in April of 2014. Sally will bring her personal experience with SUDEP as well as valuable information about the services and supports offered by the SUDEP Institute. I would now like to turn it over to Dr. Hirsch and Sally Schaeffer. Thank you.
Thank you so much. That was a great welcome, and I'm happy to be here and happy to be sharing this information. As you mentioned, this is a really tough topic, and hopefully with the information that Dr. Hirsch and I are able to provide, it creates a sense of empowerment with the knowledge that we're able to give you. As explained, I'm Sally Schaeffer. I am the Senior Director of the SUDEP Institute. The SUDEP Institute is a program within the Epilepsy Foundation, and I'll talk a little bit about our goals in just a second. But before we get started, SUDEP, sudden unexpected death in epilepsy, want to give you some information about what really started the SUDEP information and education and awareness. Chris, as you see pictured here, was diagnosed with epilepsy in high school. He had had some episodes before that, but never a full diagnosis. He was a star baseball player. He was seizure-free after sophomore year until he died in college. The doctor who treated him and shared with his family said that SUDEP is rare and poorly understood. And at the time that Chris passed, there wasn't any research opportunities available. Chris's mother and father have worked tirelessly for SUDEP research and really have been the great pioneers in bringing awareness and education to the topic of SUDEP. So I share this because these folks started so many years ago, really bringing this awareness to this topic and making sure people are informed about it or wanting them to be informed about it. Another individual who unfortunately succumbed to SUDEP is Danny. Danny started having seizures at the age of 2 and only had 4 seizures in over 2 years and all nocturnal. And he suddenly died 4 days after a routine visit. His family had never heard of SUDEP. And what you may know as the Danny Did Foundation, their tagline and really their motto of how to move along in life is please go and enjoy your life, Danny did. Again, another set of pioneers in really bringing awareness and education to SUDEP. So the SUDEP Institute, this program is developed, it's within the Epilepsy Foundation, available nationwide, and it was developed in 2013 with the idea of bringing, again, awareness and education, but also helping support and drive the research behind it. And so our mission of the SUDEP Institute is to eradicate SUDEP and support those affected by it. We have three main goals within the SUDEP Institute, and it is to support the research to help end SUDEP. And so we support the Centers for SUDEP Research. We'll talk about that in a little bit. We have a biomarker challenge out right now to see if there's a biomarker, a predictive, valid biomarker to help prevent SUDEP. And we're building partnerships with organizations nationwide to help support and drive the research. Eventually, I mean, we want to end SUDEP. That is it. We also want to provide education and awareness, and we want to increase this education and awareness not only with medical professionals, but people like you living with epilepsy. How can you help reduce your risk? What can you talk with your medical professionals about and help to prevent SUDEP? And so that is another goal of the SUDEP Institute. It certainly isn't to make you feel uncomfortable or scare you, but it is really to arm you with information. And lastly, for those that are affected by SUDEP, the loved ones that are left behind, we want to have this SUDEP support services. And so we share information about our SUDEP support services. I'll talk about that a little bit later. But here are the three goals, simple goals of the SUDEP Institute. So a little bit about me. You heard a little bit about my professional background, but I was blessed 11 years ago, almost 12 years ago, with a little girl, Lydia. As Monica had explained, she was diagnosed with a nocturnal epilepsy, electrical status epilepticus in sleep, otherwise known as ESES. She seized over 80% of her non-REM sleep, and we would lay her down to sleep, and it looked like she was sleeping like a baby. You couldn't see anything outwardly. It was a very rare nocturnal epilepsy, and we tried a number of different medications. We even talked about the option of surgery. However, on Mother's Day in 2014, as I mentioned here on the slide, my true journey would begin when my daughter did not wake up on Mother's Day morning. The most painful goodbyes are the ones that are never said and never explained. I would say that was definitely true for the loss of my daughter. There's not a day that goes by that I don't think about her. However, I've taken my journey of advocacy for her before she passed away, and now advocacy since she has passed, into this role as a SUDEP director, so that I can help those living with epilepsy as well as those that have suffered a loss, and really help drive home the awareness. I always say I could have folded. I could have said, you know what, she's gone. But that is not where I want to be as the director of the SUDEP Institute and here at the Epilepsy Foundation. I want to help empower people with information. I want to help them feel strength from this information, that they can help take control of their health and their epilepsy and know about SUDEP. As you can see here, this is a side profile of me. I am an ambassador with the Epilepsy Foundation and Epilepsy Campaign. And I think some of those words really ring true. Tireless, parent, optimist, advocate, and I want to continue to do that. And this type of webinar is exactly that. Knowledge is power. And again, I want you to feel as we go through this webinar, not scared or nervous, but more powerful with the wonderful information that we're going to be giving you and arming you with this knowledge to move forward. So at this point, I want to turn it over to Dr. Larry Hirsch.
Okay, thank you very much, Sally. And I really want to applaud Sally and people like her that can take a personal tragedy like this and really do so much good afterwards, as she has done. And I want to thank all of you for taking your evening to talk about or listen about a topic like this, which is a very difficult one. All right, let me see if I can get these slides to work. There we go. Okay, so what is the definition of SUDEP? Well, it stands for sudden unexpected death in epilepsy. Just what it sounds like, but it needs to be a non-traumatic death in someone who has epilepsy where there's no other cause found. And if they have an autopsy done and there's still no other cause, that's called definite SUDEP. If there's no autopsy done, it's called probable SUDEP. And if there's some other potentially competing cause of death, then it's called possible SUDEP. So that's a definition, a pretty simple one. It's people in their usual state of health who are suddenly found dead, most of the time in sleep. So if you look at people with epilepsy, oops, see if I can get back, that's good, and see what caused their death. Everyone dies eventually. This is the kind of numbers you get. So if you look each year in the United States, this is from 2014, there's about 6,000 deaths in people with epilepsy in the year, and these are the causes of it. You see the most common cause of death in people with epilepsy is indeed SUDEP, with over 2,000 people in the United States in 2014. And you see the other ones listed. Having epilepsy is also a risk factor for dying from injuries, from drowning, from status epilepticus, which is prolonged seizures. But they're smaller numbers than the SUDEP group. See if I can get the next slide to come up. There we go. So these are the actual numbers. So each year, about 1,000 people living with epilepsy die from SUDEP. And the most recent data shows that this is the same in children and adults. I used to think it was lower in children, but it may not be. It looks like it's very close to the adult rate. And if you look at people who have uncontrolled seizures despite multiple medications, it's a higher rate of about 1 out of 150 people each year. Now these sound like pretty scary numbers, but to help put it in perspective, I want to give some of the everyday risks that we submit ourselves to and that we accept without really giving it too much thought. For example, there's about a 1 in 2,000 chance of dying from some type of accident every year. And these are numbers from the CDC website. There's about a 1 in 8,000 chance of dying in a car accident, 1 in 5,000 to 6,000 chance of dying from unintentional poisoning or overdose every year. So the SUDEP rate is a little higher than these, but not dramatically. And the good news is there are some things you can do to lower your risk of SUDEP. Although it cannot be completely eliminated, it can certainly be decreased. If you look at the lifetime incidence in people who have treatment-resistant epilepsy, that's epilepsy despite medications, if you go up out to age 80, about 35% of people will die of SUDEP sometime in their lifetime. So what age is the most common? It's really young adults is the most common age, but it can happen at any age. If you see from this graph, it looks like as you get significantly older, the rate goes way down. And that may be true, but more likely it's actually because the death gets blamed on other things, because people have other comorbid illnesses, or it's assumed to be because of some other condition. So it may be the rate doesn't go down as much as it appears to. So what are the risk factors for SUDEP? So the number one risk factor is uncontrolled seizures. And the greatest risk is in those people who have uncontrolled convulsive seizures. So this is what people call grand mal seizures, generalized tonic-clonic seizures, or similar names. So these are big seizures with loss of consciousness, stiffening and shaking bilaterally. They last about 3 minutes or so, and usually take several minutes to wake up after. And within the convulsive seizures group, the highest risk is those who have uncontrolled convulsive seizures in their sleep. So there are some other risk factors that have come out in some studies, but not others, or they come out, but they're much smaller risk factors. And some of them there's nothing you can do about, like when epilepsy began or age, or having epilepsy for a long time. But other ones you can do something about. So it's been pretty clearly shown that not taking medications as prescribed is a risk factor. And the other ones here, it's harder to do anything about. So what exactly causes SUDEP? Or why does someone who's had 100 or 300 seizures suddenly have one and not survive or not wake up from it? So most of the time it is related to seizures. I'll tell you about that a little more in a moment. And most of the time it happens at night. And it happens when there's a problem either with breathing, with your heart, or with brain function, or some combination of them. So we do know it's usually associated with seizures. If you take cases that have been witnessed, about 90% of them will have had a witnessed seizure. And in most of them, there was some difficulty breathing related to it. In the most recent studies in people in epilepsy monitoring units in many countries, mostly in Europe, really every case that was recorded and documented occurred at the time of a seizure, and virtually always a convulsive seizure. So these are the main mechanisms I mentioned. Really the only ways to die is that either your heart stops or your breathing stops. And it's looking more and more like the breathing issue is the most important one when it comes to SUDEP. And the cause of that is a little less clear, and it probably has to do with brain control of your breathing. So we automatically breathe, and that comes out of the brainstem, the very bottom of the brain, where it says respiratory centers on this picture here. So that's in the brainstem. Seizures come from higher up in the brain, in the cerebrum, but they can spread into the brainstem, and they can affect brainstem function. So one of the thoughts is that as seizures spread into the brainstem, or as the after effects of seizures before the cells have recovered, that makes the respiratory center not function. There are some other parts of the brain where seizures come from where we know it might actually cause a sudden stopping of breathing. And it's very hard to notice that. People really don't notice when somebody is not breathing. They do notice when they're breathing extra hard and having trouble, but it's very hard to notice when somebody's not breathing. So cerebral shutdown refers to the fact that after a big seizure, mostly convulsions, the brain looks very flat when we record its activity. And then it gradually, over several minutes, gets back to normal activity and normal function. And we think that shutdown sometimes is extreme. It's more severe and lasts longer. And sometimes it involves the brainstem. The cardiac one was the easiest explanation to understand, where a seizure might trigger a heart arrhythmia. And that can happen, and it has been documented, but it seems to be much less common than the respiratory cause. So in all of the well-recorded cases, it seems there's a lack of breathing or insufficient breathing way before there's a problem with the heart rhythm. So it looks, again, the respiratory system is the main one, some control of breathing, and it probably comes from the brain's control of breathing. So the good news is there are things you can do to reduce the risk of SUDEP. So the most effective way is to get rid of seizures. So obviously you want to work with your doctor on this. You want to make sure you're getting expert care if you're still having seizures despite trying multiple medications. You should definitely want to be seeing an epilepsy specialist at that point. And as long as you're within reasonable travel distance, the best is to be seen at a comprehensive epilepsy center. So there's 2 of those in Connecticut on the that are officially approved by the National Association of Epilepsy Centers. That's Connecticut Children's in Hartford, and the Yale Epilepsy Center, which has both a pediatric and an adult side. You really shouldn't just settle for persistent seizures, particularly if you're having convulsive ones, without considering all treatment options. So that's additional medications, that's still very underutilized. And that's one of the best ways to have a chance of completely getting rid of seizures is through surgery. Not everybody is a candidate, but many people are. And now there's more devices becoming available. These are implanted devices. There's a vagus nerve stimulator that's been around for a couple decades. There's a responsive neurostimulator that gets implanted in the skull and reads your brain activity and will stimulate the brain to stop it from spreading. That's been available since 2013. And most recently, deep brain stimulation got approved for epilepsy as well. So we're getting more and more devices too. So the comprehensive epilepsy centers can give you more information on that. Medication adherence, as I mentioned, there's pretty good data that not taking medication reliably or being on no medication despite having epilepsy, those are both risk factors for SUDEP. Another thing I mentioned here is it's important to be aware of some interactions. Probably the most notorious one is someone goes on hormones or an oral contraceptive while they're taking Lamictal or lamotrigine. There's a big interaction there, and the Lamictal levels can go way down to about half or less of what they were. So that's an important interaction that you have to make sure you let your doctor know if you're going on new medications that might interact. Avoiding seizure triggers, this is a big one. I listed the biggest known triggers for seizures. So alcohol and sleep deprivation are the two biggest ones. And it's not while you're drinking alcohol, it's usually the next day. And sleep deprivation, especially a chronic sleep deprivation, will make seizures much more likely. And certainly combining alcohol and sleep deprivation is really a big risk for seizures, which is why I do always talk about this and talk about SUDEP right before our kids go off to college, because it's the rare college student that isn't very tempted to have sleep deprivation and alcohol, and those are usually combined in many college students. So those are things that really need to be avoided in somebody with epilepsy. Not missing doses of your medication. And then many people have personal triggers that will make them more likely to have seizures that they're aware of. The occasional person has computer games or flashing lights will make their seizures worse. There are many people where stress makes their seizures worse. If you know these triggers, obviously those are things you want to avoid. The other thing you can do is make sure you have a plan for what to do with prolonged seizures or clusters of seizures, particularly if there's someone who's with you most of the time that can help you with a rescue plan. So you want to develop this kind of seizure response or action plan. Do this with your doctor, plan ahead. Make sure it's a realistic plan. If you don't think you can keep a medication with you or always have someone with you, then you need some other kind of plan. You definitely want to involve people who are going to be around you all the time, whether that's family or roommates or friends in those plans. Family members should certainly know seizure first aid. The most important thing is really repositioning patient. If their head is face down in a pillow, just turning the head can be something that is very helpful and may even be a life-saving maneuver. And there is some evidence that just stimulating the patient, just touching them in any way, may actually help them resume breathing sooner. So what about devices? There are a number of devices available that can detect seizure-like activity, especially motor activity or convulsions, where there's very regular and vigorous jerking of the limbs. So it has been shown that supervision may help decrease SUDEP risk. So just having somebody in the room is really what showed that, either through a listening device or someone actually sleeping in the same room. And the thought is that just being there, repositioning the patient or gentle stimulation might be enough to help. So having a device that can detect a convulsive seizure, send an alert to someone, may be enough to help decrease the rate of SUDEP. I should point out there is not a single device that has been shown to decrease the rate of SUDEP. That would take a very large, long study with hundreds and hundreds of people, and that has not been done. But they have been shown to be pretty good at picking up convulsive seizures, and they can send an alert, and there's at least 2 FDA-cleared devices. So they're approved by the FDA for use in picking up jerking of limbs. Again, you have to have someone who can respond to these. So if it sends a message to someone who's 20 miles away, that's not going to be of too much help, at least not for that particular seizure. This world is rapidly evolving, so the device technology is moving pretty quickly and will play a major role in treatment of epilepsy, monitoring of epilepsy, and safety. So how do these devices work? There's a variety of types. From the most simple, just using a baby monitor to listen in. There's things you can put under the mattress that will detect motion. There's now at least 2 forms of wristwatch-like devices that will pick up repetitive jerking. One of them just is an app that goes along with your Apple Watch, if you happen to have one of those. There's basically software and an application that goes with it. There's other ones that are an actual band that you wear designed just for detecting rhythmic jerking of a limb. And they will, both of those will send alerts. There are others that look at EEG activity, that's the actual brainwave activity, heart rate, sweating with measures of autonomic changes that happen with seizures. There are motion triggered video cameras. There's a device that you wear on your bicep and it can detect the muscle activity that happens during a seizure and has a very specific pattern of muscle activity that's pretty reliable at predicting seizures. So most of these will link with a smartphone or an app of some kind and can send a message to alert somebody. So most of these only have a little bit of data, and again, none of them have any data to prove that they can prevent SUDEP. But these are things that are worth considering, particularly for people who still have uncontrolled nocturnal convulsions. That's nighttime convulsions. I did want to make sure everybody's aware of the North American SUDEP Registry. So if you do happen to know someone who's going through this, it's particularly valuable if you can call them soon after a SUDEP event. But even if it's not, they still can be very useful. I listed the criteria cases that are particularly useful to them. So I get some brain tissue or DNA. If it was witnessed, if a seizure was previously recorded in any way in an epilepsy monitoring unit, if an EKG or sleep study was ever done, if they have Dravet syndrome or the chromosome 15 duplication syndrome. But even if not, it's worth calling them to see if you can contribute, and they do have lots of support information as well to help with. So that's really just calling, the family needs to call themselves, and the phone number is listed here, or just remember the North American SUDEP Registry. And with that, I'm going to turn it back over to Sally.
Thank you so much, and thanks for all that great information. We have more beyond this that we want you to keep hanging on for. We hope that you never need the SUDEP registry, but it is one of the only registries where they accept that tissue sample and they accept the medical records, and they are doing research post the person living that regards to SUDEP. And so we're thankful that they're there and doing this work out of NYU. If you are interested, whether you're living with epilepsy or you are someone passionate about the topic of SUDEP, or if you know someone that's passed, we welcome you to become an ambassador with the SUDEP Institute. I am the director of the program, as mentioned, but in order to get this message of awareness and education, it needs to go nationwide. And we want to make sure that if there are people that are passionate about this topic, they're able to help right there in their local state of Connecticut by being an ambassador and helping at local walks or community events of spreading the awareness about this, about the SUDEP Institute, our goals and our mission, and about SUDEP in general. If you know someone that is bereaved and that has lost someone to SUDEP or any other mortality from epilepsy, not just SUDEP, but it could be an accident of any type as well, you can certainly call the Epilepsy Foundation of Connecticut, or you can also call the information and referral line listed there and let them know that you'd like to talk to someone one-on-one, a grief support specialist, who also lost her daughter to SUDEP, and we can help you. You can talk to them either on the phone, talk to her either on the phone, via email, or even via text. So whatever that you're comfortable with, and that's free support for you. We also have a secure, safe online bereavement support group. So this is a group made up of people who have lost loved ones to epilepsy, and they're talking about this unique loss together and sharing their thoughts on as they go through the grief journey. And then just to let you know, the SUDEP Institute, as mentioned before, is continuing to drive the research so that we can end epilepsy, but as well as end SUDEP. The goal is that I'm no longer in this role because we have eradicated SUDEP, and I want that for myself, my daughter, and anyone else who is lost, and anyone who is living with epilepsy that wants to also prevent SUDEP. And so to do that, the SUDEP Institute has launched a challenge for scientists and researchers to submit a validated predictive biomarker to see if there is something that we can find that can help prevent SUDEP. And we're accepting those challenges until October of 2020. One of the things that we want you to take away are a few questions. So for those that are listening that are living with epilepsy, and maybe this is new to you, you have not heard about SUDEP, which we hope that your medical professional has mentioned to it. But again, we bring this information to you to empower you and give you that knowledge. And again, knowledge is power. I think, when a new mom has a baby, the doctor right away talks about SIDS. And, don't lay the baby on its stomach. We don't know what causes SIDS, but we want to give you this information so that you can try to help prevent SIDS. Same with any other ailment that you might, someone might be diagnosed with. The doctor often shares that information as well as, the possibilities or the risks. But if you have not heard about SUDEP, that is what the Epilepsy Foundation is here for, is to give you that information and empower you with that. And I can't say that enough. And so with that, I want to give you some information and questions to ask your doctor. What is my risk for SUDEP? Should I be evaluated at an epilepsy center? What can and should I do to reduce my risk? What should I do if I have another seizure? How can I prevent more? Are there other ways to lower my risk? What should I do? What should I do to reduce if I have seizures at night? What should I do if I forget my seizure medication? And hopefully some of these questions you've already talked about, but if not, we want to again give you this information. Some more questions. Should we or when should we change my medication, especially if you're having, as Dr. Hirsch explained, really having your seizures controlled is important. So if you don't have controlled epilepsy, is it time to change your medication? Is there a different medication, a different amount? And then as Dr. Hirsch talked about, there are sometimes candidates for surgery or for an implanted device, as he mentioned, the vagal stimulator. If you're failing medications, is that something to be talking about with your physician? Are there any specific activities to avoid? What instructions or guidance for family or friends? Dr. Hirsch talked about having a seizure action plan. I really encourage you to reach out to the Epilepsy Foundation of Connecticut. There are seizure action plans for schools. There's seizure action plans for home. There's a variety of different action plans that you can implement and fill out and have available for those that are around you in your specific situations. That way your family and friends can have guidance, or even your fellow coworkers. Should I consider a device? Dr. Hirsch again talked about the different devices, that there's no proof that they prevent SUDEP, but it certainly is something to have to help reduce that risk. And so is it a watch where a text goes off to someone that's close to you and lets them know that you're having a seizure? Is it some other device that goes under the mattress pad that lets others know and be alerted to you having a seizure? Should I consider sharing a bedroom or an apartment or a room with someone? And what else should I know? These are all really key questions to ask your medical professional. We want to give you those so that you feel armed to go and have those conversations and talk about this tough topic. We know this isn't easy. I personally know, having lost my own child, that this is not easy. But I hope that today, through this information that we've provided you, you feel more armed with information and to go and have these conversations and help reduce your risk. I want to give you some other resources. I feel like I'm throwing a lot at you, but I can't give you enough. The Epilepsy Foundation of America SUDEP Institute, the SUDEP Institute is part of the Epilepsy Foundation nationwide. You have the Epilepsy Foundation of Connecticut. There's the SUDEP Institute Facebook page. I push out information about research and things happening in this space, stories and other announcements regarding SUDEP and epilepsy. There's also the Centers for the SUDEP Research. This has been a government-funded research program specifically looking at SUDEP. And Dr. Hirsch, you could probably expand on this too, but this research is with individuals looking at cardiac, they're looking at respiratory, they're looking at brain function. I mean, I think one of the researchers out of Iowa is looking at sleep apnea. Is that something that contributes to SUDEP? So a lot of great research in this space, and I know the SUDEP Institute and myself and the people at the Epilepsy Foundation, we want to continue to evolve this research and have these researchers talking on a continuous basis, and even researchers outside of the Centers for SUDEP Research. There's also something called the Partners Against Mortality Conference. I believe there's been 3 or 4 of these conferences. They happen every 2 years, and we bring in individuals from all over the world to talk about SUDEP research. And families can attend this, and individuals living with epilepsy can attend this, so that's available. As Dr. Hirsch talked about, there is the North American SUDEP Registry. There's other organizations that support SUDEP awareness, and that is SUDEP Aware, SUDEP Action. I mentioned the Danny Didd Foundation, the Chelsea Hutchinson Foundation, the Jenna Robinson Foundation. There is more that I'm sure that I have not listed here, but definitely a lot of great organizations that really are bringing this awareness factor. There's also the Centers for Disease Control and Prevention that talk about SUDEP. And then we have the American Epilepsy Society. That's the organization for the medical professionals focusing on epilepsy. We've come to the conclusion of our presentation, and so Dr. Hirsch and I are both available here for questions. And so I'm going to turn this over to Monica, who's been fielding those questions coming in, and let her ask us.
Okay, for those of you who maybe logged in a little bit later, if you have questions, you can please type those in at the bottom in the little chat section, and we'll go ahead and get those to the appropriate presenter to get those answered for you. While we're waiting for some questions, if anyone has questions, I do have a few, I guess, for Dr. Hirsch. You mentioned at the beginning, Dr. Hirsch, that it mainly, SUDEP mainly occurs at nighttime. Can it happen during the day as well, though?
Yes, it can. It's much less common, but it can happen in the day as well. Almost all the things I said none of them are 100%, including the convulsions one. Again, it's almost always people with uncontrolled convulsions, but not quite always. So they're big risk factors, but it's not every case. While we're waiting for questions, I'll just make a couple other comments that I thought of while Sally was presenting. So she mentioned the vagus nerve stimulator. There is data on SUDEP in the patients who have the vagus nerve stimulator, and also recent data on those who have the implanted responsive neurostimulator. And for those who have those in for many years, it looks like the SUDEP rate is ends up being about 1 in 500 per year, which is significantly lower than the expected comparison rate in people with really refractory seizures of 1 in 150. So it looks like people who have those devices for years, the SUDEP rate is lower, and it's probably just because they're having fewer seizures. Even though that most of them are not seizure-free, they're having fewer seizures, which is probably enough to lower the rate. The one other point I wanted to bring up was with all these devices, they do cost money, and if that's really a limiting factor for people, I believe several of these foundations that were listed and referred to offer some financial support. I don't know if Sally or Monica have more information on that.
Absolutely. Danny did, I know, is one of them, the Chelsea Hutchinson Foundation, and possibly the Jenna Robinson Foundation as well. They help if you have a device in mind that you're thinking about or wanting. They don't give advice on what devices, but they will at times help with funding. So they're worth reaching out to for that.
And another good question I hear would be, are tonic-clonics the only type of seizures that put people at risk for SUDEP?
Not quite, but it's the vast majority. Some studies are as high as 25% of the SUDEP cases did not have a history of known convulsions, but in a more recent study where all the seizures were monitored, really every one of the cases of SUDEP had a convulsive seizure. So I think it's probably 90%, 90% plus, but it's not every single case.
And do you think it's because of the movement that's happening, like just the tension involved, and then also the rhythmic jerking too?
It's probably not directly the movements. It's more the brain activity being very severe, and after it ends, the brain activity is very suppressed, and the brain stem might be very suppressed as well, which which prevents normal breathing from resuming. Also, during a convulsion, a lot of other things happen. You get a lot of lactic acidosis produced, and that acidosis actually suppresses breathing as well. Your oxygen drops, your carbon dioxide goes up. So there's a whole bunch of physiologic things happen during convulsions. Some of that can be exacerbated if the airway is partly obstructed, if they're face down. So it really takes a whole bunch of these things combined at once to lead to SUDEP.
And Dr. Hirsch, I don't know if this is appropriate question or not, but we oftentimes get asked, and I understand that usually when someone has a seizure, CPR is not necessary. But would there ever be a situation where CPR would be necessary?
Yes. So if somebody is not breathing at all and does not have a pulse, then that's when CPR is necessary. And that is the rare seizure where the patient doesn't start to breathe again. So yes, and it's what's called near SUDEP, when somebody basically has a seizure that has cardiac arrest, but they're successfully revived or resuscitated with CPR. So yeah, there have been cases of that. Unfortunately, there have been cases of CPR being unsuccessful as well, even when it was done rather quickly. So yeah, so if a patient is not breathing, doesn't have a pulse after a seizure, then yes, that's when you do CPR. But CPR is only when the patient, again, is not breathing at all.
And that would usually be after the seizure.
Right.
Yeah, okay.
Right, during the actual convulsion, first of all, it's very hard to tell if there's any breathing going on, and it's very hard to tell if there's a pulse. But you cannot be seizing if you have no heartbeat. Your brain will not get any blood flow, and it will stop seizing. So if they're in the middle of a seizure, then they do not need CPR. They still have blood flow going to their brain.
Okay. Well, I guess if there are no further questions, to let everyone know who's listening, we do offer a variety of services here locally in Connecticut that may be helpful for you and your families. One of them, we do have a LivaNova transportation program that is supported by LivaNova, which is the company that puts out the vagus nerve stimulator. So if people are in need of rides to appointments, particularly for neurology appointments, that's something that we provide. And we are available to help people develop health plans, whether it's in their home or just provide the correct materials to share with your schools if you have young children in school, to make sure that they are equipped with the appropriate information to care for your children. This webinar has been recorded and will be available on our website, where you can also learn of other services and programs that we provide here in Connecticut. And our website is epilepsyct.com. And if anyone does think of any questions moving forward, if you'd like us to, reach out to Mrs. Schaeffer or Dr. Hirsch, we certainly are able to do that to get the answers to your questions. But on behalf of everyone here at the Epilepsy Foundation, we'd like to thank you all for taking time to participate in this evening's webinar. As mentioned, we understand this is not a difficult subject matter, but one that is appropriate and necessary. Thank you, Dr. Hirsch, and thank you, Sally Schaeffer, also for your expertise and for your time that you took to prepare this and to present this evening. Thank you.
Thank you.
Thank you. Thank you so much. As you mentioned, Monica, this is not an easy topic, but I'm so thankful that the Epilepsy Foundation of Connecticut and Dr. Hirsch came on today to give this knowledge and empower people with information so that they can have these conversations and help reduce their risk of SUDEP. Thank you so much for having me.